Mabuhay to all the likers and subscribers. I'm Dr. Lillian Lasaten Ebuen. You can call me Dr. Lillian, Dr. Ebuen, Dr. Lian, or simply Lillian. Here in my channel, I will be sharing my life lessons and advocacies and learnings in 32 years as a dentist. I want to be the most helpful dentist by imparting my knowledge and expertise to all of you. In this episode, I will be answering 10 most asked dental questions on the internet. So, let's begin. Question number 1. Do whitening toothpaste really work? So, okay, whitening toothpaste, gumagamit tayo ng whitening toothpaste because we want our teeth to be white. But honestly, it just removes the stain sa tooth surface ng enamel natin. So yes, true. Pag natanggal yung stain, pumuputi. But basically, yun na talaga yung color ng teeth natin. However, if you expect na talagang puputi yung ngipin ninyo because the whitening toothpaste says so that it does whitens your teeth, eh kung ang ngipin naman natin talagang may dark stain na, like it's inborn, or pinanganak tayo na meron tayong mga tetracycline stains and all that, whitening toothpaste will not work. But if you want to really get white, shiny white, pearly white teeth, no, na whiten talaga, then I would strongly recommend that you please go visit your dentist and get a professionally done whitening treatment. Yan. Okay, so I hope that solves the problem. Question number 2, why should I floss? Isn't brushing enough? Yan, so parang floss, syempre kailangan natin mag-floss ng ngipin. Kasi syempre, ang toothbrush, surface lang ang nababrush dyan. Surface lang ng ngipin. But it doesn't go in between your teeth. Hindi natin nalilinis in between our teeth. So what happens is, naiiwan pa rin yung plaque na namumuo doon sa gilid ng mga ngipin. Whereas, if you floss, syempre, yung mga tinga-tinga natatanggal doon sa loob. So, floss is very important. Question number 3. How can I prevent cavities? Oh, okay, simple lang naman to prevent cavities. First, brush your teeth regularly. You brush your teeth every time you finish eating. Okay, of course, minsan, at least man lang, brush your teeth twice a day, no? Like, brush in the morning and then brush your teeth at night. Not only that, when you brush your teeth, you have to brush at least 3 minutes, no? Wag 3 seconds or wag 30 seconds. Sa umaga, okay, sige, excuse na yon. 1 minute brushing, sige, okay na yan, forgiving yan. However, pag gabi naman, pag mag-toothbrush ka, siguro mo wala ka nang habulin na traffic, no? Hindi ka malilate sa trabaho kasi matutulog ka na. All you have to do is jump down on your bed and sleep. So before you go to bed, please take your time to brush your teeth. At least 3 minutes minimum. Yon. So then you can prevent cavities. Not only preventing cavities by brushing your teeth, of course, we still need to visit our dentist regularly. Importante na nagpapakonsulta tayo sa dentista kung meron tayong nararamdaman mga sakit ng ngipin, nangingilo, or may cavity. Please, go visit your favorite dentist. Okay? So that's how we can prevent cavities. Oh, meron pa pala. Eat good diet. Siyempre, hindi naman pwedeng kakain ka lang ng puro tsokolate dyan. Siyempre, matamis ang chocolate, no? Kain ka ng healthy food like vegetables, no? Drink a lot of water. Don't drink a lot of soda. Please, did you know that soda has a lot of sugar? And sugar helps build cavities. So, kung hindi ka nag-toothbrush ng matagal, tapos uminom ka ng soda, then expect you get cavities soon. Yan. And, syempre, low carbohydrates. Yan. Carbohydrates have a lot of sugar also. Yun. And that's how we prevent cavities. Again, don't forget, visit your dentist regularly. At least twice a year. Yan. Question number 4. What are the dangers of oral piercing? Oral piercing, ito ba yung, okay, ang piercing, di ba, ang pinipierce lang alam ko yung hikaw, di ba? Bakit pati dila kailangan i-pierce? Parang sakit nun, di ba? Or ipipierce mo yung, okay, yung gilagid ba? Or yung inner cheeks mo, even the tongue. Yeah, I see patients na who has oral piercing. And it is actually dangerous. You know why? Can you imagine yung hikaw mo habang kumakain ka nang hinunguya mo together with your food, nangunguya mo yung piercing mo, no? Oral pierce. Yung hikaw sa bibig. My God. Mamaya yan, malunok mo yan. So, delikado. Diba? Not only that, the fact that it's metal, that metal is, when you chew your food, it continuously hits your enamel, your tooth. So, it can cause fracture as well. So, I will not really recommend oral piercing. Pero syempre, kanya-kanyang ano yan kanya-kanyang type yan. Syempre, walang basagan ng trip, diba? So, sige lang. Go ahead. Get that piercing, but please, don't complain pagka nag-crack yung ngipin ninyo. Definitely, it will fracture in the long run. I personally discourage it. Yan. Okay. Question number 5. What causes canker sores or singaw? Canker sores is basically heat ng katawan yan no? So, it's like a virus. Ito yung parang sugat sa gilagid or sugat sa lips, ganyan, no? So, there are a lot of reasons how we get canker sores ng singaw. So, pwedeng bacteria, syempre, lalo na kung hindi tayo nagtutoothbrush everyday kasi antok na tayo, nakakalimutan natin mag-toothbrush, expect in the next few days, may singaw ka na. Okay. So, canker sore can come from other reasons also, other health issues, ganyan, no? So, when you get singaw, I strongly recommend, again, to please go visit your favorite dentist para i-consult because this may be small or can be a small sugat in the oral cavity, in your cheeks or in your lips or in your tongue, but it can also progress to a more serious problem. So, please go visit your dentist and show your singaw. Question number 6. What should I do about bleeding gums? Naku, bleeding gums is a number 1 issue talaga, no? Bleeding gums is very hard to address. Basically, where do we get bleeding gums? Yun na muna how do we get bleeding gums? If we don't brush our teeth regularly, then our gums will become puffy and swelling. And, okay, sample ko ulit dito. Meron ako dito, okay, ayan na naman. Wait. Diba? So again, this is our tooth. A very healthy tooth. Healthy tooth is supported with healthy bone. And, syempre, may mga ligaments dyan that holds the tooth to the bone, that connects the tooth to the bone. So what happens is, pag hindi tayo nag-toothbrush ng maigi, yung bacteria will go inside, in between the gums. So, ganito mangyayari dyan. So, punta na siya sa in between the gums. The moment there is bacteria in between the gums, then you start to develop bleeding gums. Ito na yung panahon na once you brush your teeth and you spit out your toothpaste, no? Pagka nag-gargle na tayo, nakita niyo oops, mayroong tinge of blood na kasama si toothpaste. That is already a sign that we need to go visit our dentist. Ibig sabihin, nagkakaroon na tayo ng gingivitis. It's bleeding gums. So that bleeding gums can progress to not only gingivitis, but periodontal disease. So, eto mangyayari dyan Explain ko lang a little bit further, no? So, pag nagkaroon ng bleeding gums, dito pa lang, may bleeding gums ka na. It may not be serious, it may not be painful. However, that inflammation and that bleeding gums is already a pool of bacteria. Meron kang factory ng bacteria dyan. So, nag-aalaga ka na ng bacteria. Yung alaga mong bacteria, dahil hindi mo dinala sa dentist, what's gonna happen is, it will continue to destroy the bone that's holding your tooth. So, can you imagine kung ganito kaganda originally, no? Ganyan kaganda yung bone. nung malinis pa yung teeth mo, masipag ka mag-toothbrush. Tapos biglang hindi ka na masipag mag-toothbrush kasi akala mo kompleto pa naman yung ngipin mo, maganda pa, no? Wala namang pain yung gums mo. So what's gonna happen? Yung alaga mong bacteria dyan, yung factory of bacteria dyan will continue to go down and destroy, and this bacteria will continue to destroy the bone. So yan, gum disease ang tawag dyan. Anyway, or periodontal problem. So, that bleeding gums, for you to avoid getting bleeding gums, please, again, ayan na naman, sikat na sikat talaga, go visit your family dentist para maagapan ka agad yung ating bleeding gums. Next, question number 7. I'm undergoing chemo radiation for cancer treatment. How does this affect my mouth? Okay. Patients who have health issues, especially this big C. Well, not only big C, but basically patients who have a lot of health issues or encountering a lot of issues. It may not be big C. Actually, it can also be psoriasis. It can also be skin diseases or anything. Oral health is important because what happens if you have these health issues, if you are health compromised, what happens with your oral health is bumababa yung immune system natin. So what happens, yung oral health natin nagiging poor din. So there is less saliva, there will be a lot of infection, there's a lot of bleeding gums and swelling gums because nagkakaroon tayo ng dry mouth. Yun. So it is also important that we continuously drink a lot of water, at least maintain that para at least makatulong na kahit sobrang health compromised tayo, if we take a lot of water, drink a lot of vitamins, then our oral health will not be that much affected. Yan. Question number 8. I'm pregnant. Not me. Dito sa question. I'm pregnant, sabi niya. How does this affect my mouth? Of course, natawa ko sa sarili ko. Well, okay. When I was, explain ko na rin kasi ako, that time, nabuntis din naman ako, di ba? So I had two children. Ang women, when we get pregnant, yung immune system natin are also compromised. So, syempre, there's a growing fetus down there. So, lahat ng minerals, lahat ng vitamins, sustansya na kailangan ni baby, kinukuha niya lahat, walang natitira sa atin. So, well, may matitira sa atin, but then konti na lang. So, kaya nga, meron yung mga parents, mga nanay pala, not parents nanay, no, na sabi na, nanganak lang ako, nabawasan ang ngipin ko. Itong sunod na anak ko, pinanganak yan, nabawasan ang ngipin ko. Bakit? Kasi, ang problema doon, when we are pregnant, yung vitamins ng katawan natin na kinakain natin, mga nutrients, the baby gets it all. Walang natitira sa atin. So, what we do, we have to supplement ourselves. When we're pregnant, we have to supplement ourselves, take a lot of vitamin C, eat a lot of good food, healthy food, and visit your dentist. Visit your dentist because, syempre, pag mababa yung immune system natin, what's gonna happen is yung gum problem natin na-develop. So, kasi nga, mahina yung immune system natin, then we start to get bleeding gums as well. So, regularly, for pregnant women, please go visit your dentist at least every 4 months, ganyan, no? During the time that you are in pregnancy. Question number 9. Is vaping and smokeless tobacco harmful? Oo naman. Siyempre, as a dentist, it's important. And we all advocate no smoking. Dapat no smoking. Kahit pa smokeless tobacco yan, no? That's more harmful than harmful smoke. Yan. Still smoke. It still has nicotine. Believe me, it may not show stain on your teeth, but it will continue to give you bad effect for your lungs. So, choice naman ninyo yon if you want to go vaping. Siyempre, yun ang uso, no? Smokeless para hindi halata. Please, don't vape. Yun na yun. vaping is very, very harmful. Yan. Question number 10. What can I do about bad breath? Siyempre, pagka may bad breath, the best thing you can do is go visit your dentist. Magpa-cleaning po tayo. Kailangan natin magpalinis ng ngipin. Of course, there are also other reasons why we get bad breath. Okay, siyempre, para maiwasan ng bad breath, mag-toothbrush tayo araw-araw. And not only araw-araw, mag-toothbrush tayo sa umaga, mag-toothbrush tayo sa gabi, you take your time to brush your teeth. Next, go visit your dentist. Okay, maaaring kompleto yung ngipin mo, pero hindi mo alam may bleeding gums ka. Hey, that bleeding gums is also a source of bad breath. Another source of bad breath, cavity. Maaring akala mo kompleto yung ngipin mo, pero you don't know, at the back, meron kang cavity. Tapos, nag-gargle ka na, nag-mouth rinse ka na and everything. Tapos, may amoy pa rin, di ba? So, saan galing yung amoy? Maaring galing sa cavity. So, did you know that if you have cavity in your mouth, watch out pala ha, for parents out there who have babies, yan, no? O who have toddlers, yan, mga cute na bata. Be very careful with the yayas. Pag may cavity si yaya, nata-transfer po yung mga Staphylococcus, Streptococcus doon sa bata. So, airborne din siya. Pag may bleeding gums ang yaya, possible na malanghap or makuha ng baby natin. So, be very careful. Make sure na good oral health din ang yaya. Not only the yaya, you as the parents, brothers and sisters, di ba? Dapat everyone must have good oral hygiene para healthy ang lahat sa pamilya. Okay? So, I think that covers all 10 questions. And if you have more questions to ask, you want me to discuss some other dental topics or other life lessons and learnings in this channel, please don't forget to comment below. And again, I would like to solicit from you to please like and subscribe. Thank you all for watching. For us, every day is a day. We see the day as... Di mo alam? Oh my God! Alam mo yan, nag-pandemic. Catch me if I